for the event to complete. And as you all know, we have a gala banquet tonight. So initially, people in the organizing team never take a talk, but this talk is something very close to my heart. So people who know about me know my interest in geriatric emergency medicine. So first of all, I would like to thank the academics for giving me this opportunity to speak in spite of so many words. And I dedicate this talk to my father and mother, Father Dr.sai Mohan and Mother Mrs. Padmalakshmi Sai Mohan, who are also here. So my topic is polypharmacy challenges in the elderly, balancing risk and benefits. So what is polypharmacy? Taking more drugs. See, today we have a plethora of symptoms today in elderly. About 30% of all our emergency departments are flooded with geriatric patients. So when they come to our emergency, the commonest what they say is, kai valigidhu, kaal valigidhu, your arm pain, leg pain, supersedes everything, right? So what do? First they do self-medication at home, and then only they come to visit a doctor. So this is my talk, essence of my talk. So one of the first duties of the physician is to educate the masses not to take medicine. That is our role as a primary physician or an emergency physician. Restrict medications and maximize the patient treatment. So in geriatric age group, you all know, polypharmacy is one of the major concerns we are all looking at, which is one of the most important causes for renal failure and liver failure. So it is where a person takes multiple drugs, usually 5 or more, which can lead to adverse effects. Some examples of polypharmacy include prescribing the same type of medication twice, taking medications that are no longer needed or working, taking medications to treat the side effects, and taking medications that are difficult to manage, such as taking some before food, some after food, others at different times of day. Over 40% of elderly, as per the WHO and as per American College of Geriatric Emergency Physicians, as per the latest guidelines, over 40% of elderly individuals take 5 or more medications. An increased risk of drug interactions and adverse effects is seen in this age group. So let me define polypharmacy. As I already told you, it is administering too many drugs at the same time. And it is frequent among elderly as they suffer from chronic diseases with concomitant pathologies. So, why is polypharmacy common in the elderly? They have multiple chronic conditions. See, when they come to your ED, commonly they have diabetes, hypertension, ischemic heart disease, CKD, CAD, all. They come as a cocktail to you. So ultimately, when you see your file, their old file, you will see about 10 to 12 medications. Am I right? You all can relate this. And older adults often suffer from multiple health issues, as I told you, and there is increased healthcare providers. What do I mean by that? In our system, they see a family physician, they see a general physician, and then they come to an emergency physician. Again, they take a second advice from another physician. They see a cardiologist, they see a neurologist, and together they have a cocktail of medications and they take all the tablets. So polypharmacy is so common in this elderly. And self-medications. There are many people who cannot afford or who don't want to see doctor until it's very big. So they go to the nearby pharmacy, the pharmacist immediately gives them a anacin, diacin, whatever is the sin, and he wants the